My name is Christina Ravago, and I have been a professional guardian for 13 years, and I am with the Osceola County Council on Aging.
My name is Penny Maitner, and I work for the Legal Aid Society of Palm Beach County in West Palm Beach. And I've been working here uh, as a case manager in the guardianship program for 6 years.
My name is Leila Sixto Padron with the guardianship program of Dade County, and I've been with the guardianship program for 17 years.
Hi, my name is Shantae Jones. I am the executive director at the Office of Public and Professional Guardians, housed within the Department of Elder Affairs.
Well, working with a public guardian is very rewarding. Like, it has its challenges like anything, but the positive and rewarding side of it actually outweighs it. You know, we have a lot of clients that don't have anybody and need the support. They don't have family that visit, and some that do, they're very dysfunctional sometimes, and so they have us as their family.
It gives us, give me personally an opportunity to serve the underserved, people who don't have funds, the developmentally delayed, mentally ill, people who have never had a work history, so that we could provide a better quality of life for them.
Public guardianship is important because we do have vulnerable citizens within the state that need guardians. They may not be able to make those most important life decisions on their own, and they may not have a family member or a friend or associate that can step in those shoes. Our public guardians absolutely step in at that opportunity when they're needed the most.
I became a guardian when I worked for many years in the healthcare field, and I saw so many vulnerable adults that didn't have anyone to advocate for them. For example, a simple room change in a nursing home to someone who has dementia can really distort their being, and it could really affect their health care.
So I have always been interested in psychology and helping people. When I was in high school, that was something I always said I was going to, focus on, and I did. And when I heard about guardianship, I was like, this is different. Not your typical, mental health kind of, agency. It does so much, and we're very diverse, very unique.
The general public generally doesn't understand guardianship. They don't understand that it's a team approach. I think between the ward and the guardian, it has to be a team approach, unless the person has absolutely no ability to make any decisions for themselves, such as someone who is born developmentally delayed. And I think with the team approach, I think we can better serve the client because you have various responsibilities assigned to different people.
I think our communities just aren't very knowledgeable that guardianship even exists. I think we need a lot more education to physicians, to churches, to just all these entities that are out there, because guardianship could be a very positive approach to helping someone who's in need and able to make decisions for themselves.
And, not a lot of people know about guardianship. So they have they either have a bad, thought of it because of what they hear in the media or see on the shows or the movies that they have out there. But we're not like that. It's not like that at all.
So the type of oversight that our office provides is a combination of a dual role within our office as well as the judiciary. We're ensuring that guardians across the state are adhering to statutory requirements as far as education, their bonding requirements, in addition to registration requirements. And lastly, ensuring that they're following the standards of practice. Oversight is important from our office because it gives our citizens a sense of security that there's someone looking, ensuring that there is not abuse, neglect, or exploitation, or preventing that abuse, neglect, and exploitation. So oversight is just another way of checks and balances, making sure that they're cared for.
I think to become a professional guardian or a public guardian, it takes knowledge of healthcare, finances. You do a little bit of everything when you're a guardian. from helping on a sale of a home to a car to purchasing maybe a home, purchasing a vehicle for transportation to medical appointments. So I think it takes a very large array of knowledge, but I think the most that it takes is a lot of patience, a lot of compassion.
There is some limited funding that our offices provide to them, but we're always in need of the community to step in, some of those local and county officials to step in and help serve your communities for public guardianship.